where we will be working to break down and demystify some of the highest yield biochem pathways that you're most likely to see on your Step 1 boards exam. So in approaching biochem pathways for your Step 1 boards exam, the most important thing you want to avoid is sitting down and memorizing every single intermediate and every single enzyme, because you just don't have the time to do it. Instead, you want to focus on key aspects of each pathway that you can use to reason your way through questions or clinical presentations that you're likely to see in a question. So for each pathway, what we want to focus on is, where do we start? Where do we end? What are the goals of the pathway, or what is the purpose that the pathway is trying to serve within a cell or a body? And what key enzymes will get us to start from end, and what do they need to function? This will help us sort of relate to key disorders that are related to these pathways. And an important thing to consider too is how different biochemical pathways come together. And we'll see how that works when you take a look at some of the other videos that we have as well. So for today's pathway, we're going to be talking about the HMP Shunt, which is also referred to as the Pentose phosphate pathway. So relating back to what we had talked about in terms of key things to remember for each pathway, we start with glucose 6-phosphate, end with ribose 5-phosphate, NADPH, and fructose 6-phosphate. So the goal of this pathway, and when you're thinking about putting it in context, is to 1, generate NADPH for reductive reactions, which are used to prevent oxidative damage, which we'll talk about later, as well as making precursors for nucleotides. The key enzymes that we'll be talking about are glucose 6-phosphate dehydrogenase, known as G6pd, and transketolases, which requires vitamin B1. In terms of disorders they'll be talking about for this pathway, they'll be talking about G6pd deficiency and vitamin B1 deficiency. In terms of putting this pathway into context, or integrating into other chemical pathways, we'll see that it fits nicely into the pathway for glucose metabolism and nucleotide synthesis. In terms of putting this pathway in context, it's useful to draw different pathways together. So you'll see here that we drew the pathways for nucleotide synthesis, the HMP Shunt, and homocysteine elimination all together on one page. Now this definitely looks intimidating at first, and there's no need to memorize it all, but if you can see these pathways in context, it's easy to memorize how they all work and the purposes they all serve within the cell. So for now, we'll just be focusing on the HMP Shunt, which we can see here at the top. If you look at the final step of this pathway, you'll see that it will flow into the nucleotide synthesis pathway, which we'll talk about in another video, but again, it's just important to keep these pathways in context. So let's actually break down the HMP Shunt. If you can see at the top of the page, we start with glucose 6-phosphate, which is just consumed as dietary glucose. The first step of our pathway is going to involve taking glucose 6-phosphate, which again we get through our diet, and converting it to 6-phosphogluconate. The enzyme that facilitates this part of the pathway is glucose 6-phosphate dehydrogenase, which is one of our key enzymes. Now, the purpose of this step is not just to move us down the pathway necessarily, but also to generate something called NADPH from NADP. As you can see, this will later be used for reduction reactions within the cell, or for all intents and purposes reversing oxidation. And we'll talk about the importance of that later. But for now, just know that glucose 6-phosphate dehydrogenase serves a key role in generating NADPH for our cells. The next step of this pathway involves converting 6-phosphogluconate to ribulose 5-phosphate. Now, there is an enzyme involved in this pathway, but I didn't mention it specifically just because it's particularly low yield and is probably not worth memorizing at this point. Looking at the last step of our pathway, you'll see that we convert ribulose 5-phosphate to ribose 5-phosphate, glucose 3-phosphate, and fructose 6-phosphate. Now these can all be used for different things, and it's actually important to realize that this step is actually a series of steps facilitated by a number of different enzymes that are collectively called transketolases. Now what's important about transketolases? Transketolases actually require vitamin B1, also known as thiamine, to function properly. And when they're assessing people for being B1 deficient or thiamine deficient, what they'll actually do as a test is they'll measure transketolase activity. The idea being that if transketolase activity is fine, you have adequate B1, or if they measure low transketolase activity, that person is clinically thiamine deficient. So when you hear about transketolase activity, you want to keep in mind that people are being assessed for thiamine or B1 deficiency. Looking at the products of this last step, again we mentioned that you get ribose 5-phosphate, glucose 3-phosphate, and fructose 6-phosphate. Now, fructose 6-phosphate can actually be shunted back into sugar metabolism for energy, but the key product here is ribose 5-phosphate, which when you go back to our reference slide looking at the different things that we get out of this pathway can then be used for nucleotide metabolism. So again, when you go back and take a look at the integrated pathway, take a look at how ribose 5-phosphate is going to be used to help make AMP, CMP, TMP, and GMP. So as I mentioned before, the main purpose of this pathway is to generate NADPH for the purpose of reduction. But why NADPH and why reduce in the first place? So you just need to remember that reduction is essentially the opposite of oxidation. You need reduction to make stuff in the cell, so you need it for things like fatty acids and sterols, but the purpose of step 1, we care less about this aspect of reduction. What we do care about is reversing oxidative damage. So as you know, free oxygen radicals are bad for our cells. They damage our proteins and do all kinds of other bad stuff. And how does NADPH sort of attenuate this damage or reverse this damage? NADPH does this mainly by recharging a guy called glutathione reductase in the cell. So as I mentioned before, glutathione reductase is sort of the cell's go-to guy for dealing with free oxygen radicals. So NADPH helps out in this process by recharging glutathione reductase. So what do we need to prevent damage from, or what causes oxidative stress? So you can get it from things like infection, which are going to cause oxidative stress via inflammation, but you also get it from drugs and other oxidizing agents. So drugs like this include sulfonamides, primaquine, anti-TB drugs, and actually fava beans of all things. So if you're reading a question and they mention fava beans, definitely put this on your radar. So now that we know that the main purpose of this pathway is to sort of attenuate oxidative damage, the question is to ask what goes wrong, aka what are the boards likely to ask me about when it comes to this pathway. So they may ask you about the role of transketolases and specifically the role of vitamin B1, but the most high-yield aspect of this pathway by far is G6pd deficiency. So what is G6pd deficiency? G6pd deficiency is an X-linked enzyme deficiency that's most common among African Americans, but is actually the most common human enzyme deficiency in the world. Now, what happens is that cells can't make enough NADPH to counter the oxidative stress that we talked about earlier. And while this happens in all of the cells of the body, what we focus on clinically is the effect that it has on red blood cells. Essentially, if someone can't generate enough NADPH, and in that sense recharge your glutathione reductase, you accumulate signs of oxidative damage within your red blood cells themselves. So what does this do to our red blood cells? So once you generate these free oxygen radicals, they actually change the structure of hemoglobin and slowly denature it within the cells. Now when this hemoglobin changes shape and structure, it actually comes together and forms what we call Heinz bodies. So if you look at the picture on the left, those dots within our red blood cells are the Heinz bodies on peripheral smear. Now, for whatever reason, our body's immune system doesn't like these Heinz bodies within red blood cells, so phagocytes will actually try to destroy them. And how does this present? When a phagocyte tries to remove a Heinz body from a red blood cell, you sometimes get complete destruction of the red blood cell, and you'll get hemolysis. But occasionally, you'll only partially damage the cell, which leads to the formation of what we can see as bite cells on peripheral smear. So if you look at the picture on the right, you can see why they're called bite cells, because it looks like something just came along and took a bite out of them. So for all intents and purposes, when you're thinking about G6pd deficiency, you want to think about it as accumulation of oxidative stress within red blood cells that are going to lead to breakdown of red blood cells, or hemolysis, resulting in formation of Heinz bodies and bite cells on peripheral smear. So how are they going to ask you about this, or how are they going to come at you about G6pd deficiency? So the typical patient presentation that you're going to see is usually going to be an African American, just again because it's more common in that population. And you're going to get that patient presenting with signs of red blood cell destruction. So when red blood cells are destroyed, you have jaundice, so the skin turning yellow. You're going to have sort of yellowing of the eyes, and you're going to have darker urine. That's also usually going to be accompanied by some sort of fatigue or other sign of sort of systemic anemia. You're also going to see falling blood counts shortly after exposure to some sort of oxidative stress. So again, we talked about the different sources of free oxygen radicals within cells. And we've specifically talked about drugs such as antimalarials, sulfonamides, or TB meds, infection, and remember, you can't forget our fava beans. If you ever hear fava beans, you need to think G6pd deficiency. Now, the important thing when thinking about drugs is they're not just going to come out and say that someone got one of these drugs. You're not going to say they got primaquine or a different type of sulfonamide or something like that. What they're going to say is a patient traveled to a malaria endemic area and initiated treatment and then had these symptoms that we're talking about. So again, they're not going to come right out and say that they gave them a oxidatively stressing drug, but they're going to suggest that they were treated for it. In addition, when they're asking about G6pd deficiency, they may give you a family history, and they may actually give you bite cells or the Heinz bodies that we saw previously. So let's take a look at some sample questions for the HMP Shunt. In this first question, we have researchers that are studying a pathway in cultured human cells that's responsible for combating oxidative stress through generation of NADPH, as well as ribose 5-phosphate, which is a substrate for nucleotide synthesis. And the question they're asking you is which enzyme is most directly implicated in generation of ribose 5-phosphate. So if we look through this question, we can see that they're asking us about NADPH directly, they're asking us about ribose 5-phosphate, which we know is the end of our pathway, and essentially they're giving us the HMP Shunt, and they just want to know if we know some of the key enzymes that are a part of it. Now remember, we have two key enzymes that we wanted to memorize, G6pd, which is choice A, and transketolases, which are B. So if we know our two key enzymes, and we know where we start and where we finish, we can work our way through this question. So we know that ribose 5-phosphate is the end product of our pathway, and we know that G6pd is the first enzyme in our pathway. So that's off right from the beginning, leaving us with B, transketolases, which is the last step of our pathway that's going to generate ribose 5-phosphate. So this is an example of a simple question that's just asking about our knowledge about the pathway itself and some of the key intermediates and enzymes involved. This is another example of a typical question that they might give you. So you have a man with recent travel to sub-Saharan Africa who's diagnosed with malaria and started on appropriate therapy. Shortly thereafter, he begins to have complaints of intermittent fatigue and dark urine. Findings on peripheral blood smear are shown below. A loss of function mutation in what enzyme would produce similar results? So let's take a look here. Before we even go back to our question or we see anything, we can look at our peripheral blood smear that they give us and see our friends Heinz bodies and bite cells. But let's go back to the question just to confirm that we know that we're talking about. So we have a person who is diagnosed with malaria and started on appropriate therapy. So again, remember that anti-TB meds such as primaquine are drugs that are going to generate significant oxidative stress in red blood cells. So those are one of our key drugs to trigger for thinking about the HMP shunt. So now let's take a look at our answer options. So we have glucokinase, spectrin, glutathione reductase, pyruvate kinase, and pyruvate dehydrogenase. So again, it helps here to think about the purpose of our pathway. The purpose of the HMP shunt is to generate NADPH for the purpose of recharging glutathione reductase. So if we lost glutathione reductase, it's pretty much the same as losing the HMP shunt, which is going to bring us to our answer C, glutathione reductase. So let's take a look at one last question. So here we have a 35-year-old Moroccan man who presents to the emergency department with 3 days of weakness. You see mucosal pallor and mild scleral icterus, which means yellowing of the eyes. And you see those both on physical exam. So again, I want those to trigger hemolysis for you. You're thinking that some sort of hemolysis is going on. His wife recently returned from a trip to Ethiopia where the two have been sharing meals made with fruits, beans, and other vegetables that she brought back with her, though she currently reports no symptoms. So again, I want to highlight beans. So if they actually mention beans in a step 1 question, you want to put fava beans on your radar specifically for this purpose. So like our last question, they're showing us a peripheral blood smear. So they're giving you the Heinz bodies that are pointed out with the little arrows, and they're connecting that to just eating some beans. Heinz bodies and fava beans, you have to be thinking the HMP shunt. So the question is, what accounts for the structures found within the patient's red blood cells indicated by the arrow? So we know that you get Heinz bodies because you accumulate oxidative stress, which is going to change the configuration of your hemoglobin and cause it to clump together. And if you look through our options, E describes that pretty well. So you would look at this, know that you're dealing with the HMP shunt, diagnose this man with G6pd deficiency, and choose E, accumulation of denatured hemoglobin. So again, I think that it's useful to look at these pathways, look at these questions, and think about the goals of the pathway. You know, what is it trying to do? And then if you have some time to go back to our reference slide about how all of the pathways come together, it will really help you solidify this concept.